So thanks a lot for joining me today, Hannah. We're getting together to mark 10 years since the Supreme Court's decision in Cheshire West was handed down, and it's really lovely to see you.
Yeah, thanks for having me, Joe.
So I don't know about you, but I can remember really distinctly where I was in the kind of days following the decision and being handed down in Cheshire West. I've got a really vivid memory because I was delivering a full day training session on Mental Capacity Act and deprivation of liberty, which was something that we would do a lot with our friends at Afterthought Training Consultants. The afternoon part of that was about deprivation of liberty. I had this script where I would talk about the definition of deprivation of liberty, and I used to say that there was a sliding scale of restrictions. So I'd have a little I'd have my arm as a scale, and someone would be down the bottom with very little restrictions, and as more and more restrictions are applied to the person, they move up the scale until at some point they cross the line between being restricted to being deprived of their liberty. And pre-Cheshire West, I used to say, it's really difficult to say at what point that line is and when someone crossed the line, and it's a bit of a grey area between what's a restriction and what's a deprivation. And then after the Cheshire West decision came out, I said, well, the good news is we now have really clear guidance on what's a deprivation of liberty and where the line is. The bad news is it's about there. Genuinely, people were so angry in that training session. I was shocked. And if they had tomatoes, they definitely would have been throwing them at me.
Oh dear. Yeah, I mean, it did give us clarity, didn't it, at least?
Yeah,
What that line is, but I can imagine it may have been received a little bit uh tomato throwing vibes going on there, Joe.
yeah, definitely it was. What about
Uh,
you?
well, I was kind of on my journey to qualifying at this point as a solicitor. So I was always interested in kind of mental health and social care and all the things that affect people day to day and human rights. I was quite interested in human rights in university and always kind of have been. And then the Care Act was coming into force, and of course this judgment came out, and I was kind of looking at the implications on human rights because I was just had a keen interest in it. And I thought, oh, I think I could possibly, make a career out of kind of doing this maybe and see where it takes me. And then of course I just fell in love with the Mental Capacity Act, adult social care, healthcare law, and kind of just took me on my journey to where I am today, really. So yeah, I've always known a legal qualified legal life with Cheshire West. So it was the starting point of my career really was Cheshire West. So significant for me in terms of my life as well as
Yeah.
my career. So
And you've
yeah.
definitely made a interesting career choice in this area of law.
Well, it's definitely kept me busy, Joe, I have to say.
Yeah, same. I mean, that's how it's affected us. Obviously, the impact of the Cheshire West decision's been really keenly felt by our clients, both NHS, health and social care, local authorities, and particularly in terms of the resource implications to keep up with all of the demands.
Yeah, for sure. I mean, if you think about pre-Cheshire West, there's just shy of 14,000 dolls applications, I think a year in 2013, 2014. And then post-Cheshire West, it was like 137,000 plus. So you think there was a tenfold increase just following that judgment. And then every year since then, it's on average gone up by about 10%. And I think it's 2015, 2016, on average, there's been 100,000 backlog. So cases that haven't been authorised or considered. I mean, the statutory time frame is 21 days. The average, I believe, is around 156 days for a doll's application to be completed. 56% aren't granted. And only 3% of that is because they don't meet the criteria for dolls. There's There's things such as changing circumstances, maybe someone's in hospital for an acute kind of medical reason and they're discharged. Maybe they've moved from one placement to another placement, or maybe they in fact have died without the safeguards ever having been put in place. So huge. And it's not through, you mentioned the resource issue, it's not through lack of trying. Local authorities as supervisory bodies for dolls. I just remember when I first started, being let loose and supporting everyone within councils as a solicitor. It was just, everyone was just so inundated, and there was just so much demand, and it wasn't because they weren't trying to meet the demand, it's just that the resource to meet the demand wasn't there. So you always feel like even 10 years on, we're fighting a losing battle with trying to safeguard rights, which is what dolls was intended to do.
Yeah, I mean, this quite similar sort of story from NHS clients as well. So I've been supporting NHS commissioners over the years with hundreds of the COP doll applications for authorization of deprivation of liberty in the community. I mean, it's called the streamlined procedure. I think that's a bit of a misnomer because there can be very onerous in terms of the information that needs to be gathered. And there are delays with this system as well. It's not uncommon to hear from the court several months, maybe even a year after the application was filed. Although there are some improvements being felt here recently, and those numbers too have increased massively following the Cheshire West decisions. So in 2013, in one 3-month period, there were 15 applications made to court for authorization of deprivation of liberty in the community. And in the last quarter that we've got data for, that number was 1,655. So it's just a massive, massive increase in numbers. And for NHS trusts, at least the deprivation of liberty safeguards apply in a hospital. But as you've mentioned, the resource issue is felt when the safeguards are not put in place and the person has left hospital.
Yeah.
Particular challenge as well is 16 and 17-year-olds. In all for everyone really,
Every
if
environment, yeah.
yeah, so the case law says the parents can't consent to deprivation of liberty. So, if they're in hospital, they don't fall under the deprivation of liberty safeguards, and the only recourse is to make a court application.
Yeah, and I think, to think only 15 in a 3-month period were submitted to COP, it's just mind blowing really, when you think, on average, you probably, as a lawyer, either working with NHS bodies like ICBs or within social care, you're probably looking at 15-20 a week if per person, just trying to get them across the line. And the 16 and 17-year-olds as well, we had that guidance from Senior Judge Hilda advising the COP 11 wasn't really designed with 16, 17-year-olds in mind. So the best practice would be a welfare application. So there's all these different methods to achieve the same outcome, which is to safeguard rights. And the system's so significantly overwhelmed, the intention isn't really being met at all. Which is, 10 years on, it's a real shame, isn't it, to think,
Yeah, it really is.
the
I mean,
case.
these a lot of the challenges and problems that we've talked about is, of course, what the LPS was the liberty protection safeguards were supposed to have fixed.
Yeah.
And even if that doesn't come in for the foreseeable future, which seems likely, if at all, would you say that there's still a need for change in the meantime?
Well, yeah, I mean, it's it's almost like an impossible feat, and I'm going to talk from just a social care perspective here. It's there's a wider context to why dolls isn't working as effectively as it could be. And other than the system itself, there's the fact that there's a lack of resource in social care. It's been significantly underfunded over the last few parliaments. We've got a workforce recruitment crisis. Student finance has tripled, so maybe people aren't as inclined to go into a health or social care role, such as, learning disability nursing or social work, because of the cost of, and of course there's apprenticeships and things, and there's different ways of getting into that career. But it's such a broken system that dolls within the broken system. It's so hard to kind of comply with those statutory duties, and it's not through lack of trying.
Yeah.
Whether you work for the NHS, whether you work for social care, the intention is always to provide the best care, the best treatment. Some of the most unbelievably empathetic, compassionate people working in health and social care, and yet the system is not supporting them to
Yeah.
support the families and the person,
Yeah.
at the end.
I
So it's
mean,
hard.
realistically, funding is the elephant in the room, isn't it? And
Yeah,
as you say, at the risk of getting political, with a general election on the cards soon, it'll be interesting to see how an incoming government will choose to address things. But I'm not holding my breath that it's going to be high on the list of priorities for any incoming government, the latter part of this year.
no, and it's a shame because it's such an important part of our society is looking after people and ensuring they get their needs met in whatever format that is. But human rights it's a fundamental basic right, isn't it, that we're safeguarding.
Yeah.
And it's a shame that LPS has been delayed, if not potentially shelved for well, goodness knows
Who
how long.
knows? Yeah. I mean, 16 and 17s as well, we've both mentioned, haven't we, as a particular challenge, because LPS would have applied to them, and we currently still have this gap.
Yeah,
As mentioned, a 16 or 17-year-old in hospital, I think the last thing anybody wants to be doing when someone's child is sick and in hospital is speaking to the parents about having to go to court. But
yeah,
that's the only outlet for dealing with a deprivation of liberty authorization at the moment, in the absence of some change.
yeah. And the same within social care as well. We've got children transitioning from maybe being looked after children or education, healthcare needs as well, SEN, to adulthood, to adults with eligible needs under the Care Act. And that transition process can be complicated enough, um, and challenging enough, and it's an important transitional part of that young person's life. And then we're talking about, oh, by the way, you're also deprived of your liberty. We need to go to court to authorize that. There's just this LPS system was supposed to make that easier for everyone to
Yeah.
navigate. It's just such a shame that it hasn't come to fruition, really. And
Yeah.
that Mental Health Act, Mental Capacity Act interface as well. It was kind of designed to support with that, and um take some of the bureaucracy out of the system as well. It was intended that that would be the case, more cost effective, more streamlined, etc., but still safeguard the rights. That was the intention. So it's such a shame that we're still waiting for it after so
Yeah.
long.
I mean, I'm still waiting is a bit of a common theme, isn't it? Because, even without the liberty protection safeguards, we're kind of expecting an update regarding the Mental Capacity Act itself, aspects
Yeah,
of the code that was supposed to be still updated, irrespective of the decision to sort of shelve LPS. And a response to the consultation on that was expected at the end of last year, and here we are in March,
still waiting.
still
Still waiting.
waiting. As was said, it's a bit of a common theme.
Yeah,
So
and the code being updated would significantly support practitioners on the ground, especially newly qualified moving into the area in the best practice approach. I mean, they're still referring to the two-stage test in the code of practice. It's like, we are definitely in need of that update as soon as possible as well. So yeah.
yeah. So I guess while people are waiting for that, in the meantime, while we've got no LPS, we're still in this kind of resource poor system. What would you say are our top tips are for practitioners
I
navigating
suppose,
this arena?
the first thing is getting the basic MCA practice, right, and getting really confident in your own practice around assessing capacity, when you have reason to doubt capacity, how to go about making best interest decisions on behalf of those who have been assessed as lacking capacity, identifying a deprivation of liberty, all the principles, of course, being absolutely key to that. And being able to constantly reflect on your practice and develop that, keeping up to date with the law, case law, all this type of stuff. Just really getting the basics MCA right and keeping on top of that.
Yeah,
I think
there's
that's
so,
the points.
sometimes a little bit scary, isn't it? How much there's
Yeah.
still quite a lack of understanding and appreciation of some of those fundamentals in the Mental Capacity Act. Um, Early identification of deprivation of liberty would be a good thing, wouldn't it? So, whilst fully accepting, the demands that we've talked about on the system, the earlier that this can be picked up upon, dealt with, legal advice sought if it's required, the better for everyone, really. So it's empowering
100%.
people, isn't it, to identify that and then to know what to do.
Yeah, yeah, absolutely. I think that's so important because during the care planning process, often it will become apparent, that there will be continuous supervision control, they'll be not free to leave, the person may lack capacity, there's been an assessment. So as soon as you identify that, get some good advice. And on tricky cases as well, get advice as quickly as possible because um, lawyers are experienced in this area, especially the likes of Hill Dickinson with health professionals and in-house legal teams that I support at times. We're all there to help the
Yeah.
frontline professionals in a pragmatic way, but a legally literate, sound way as well. So the sooner you can get advice, the better. That is definitely a big top tip, I would say. And having good relationships as well as a kind of third point with your colleagues, whether you're a social care professional working with health and vice versa. As we move towards more health and social care integration, having those really good relationships with other agencies and partners. So these conversations, which sometimes feel challenging and overwhelming to have, can be had in a safe space. There's a
Yeah.
safe organizational context around that as well, I think is really important.
Yeah, good relationships and cooperation just makes it easier for everyone, doesn't it?
Absolutely.
Instead of being against each other, everyone's got the same aim, haven't they? We're all working together for someone's best interests.
Yeah,
So yeah, that's so important. I mean, I know it's one of the principles of the Mental Capacity Act, but least restrictive option is
yeah,
worth hammering home, isn't it? Because occasionally, just despite the low bar, I guess that in Cheshire West, occasionally, we can reduce restrictions on a person that mean they're not being deprived of their liberty, or even if they're still deprived of their liberty, it can improve someone's quality of life and it reduces the scope for challenge. Things like Section 21A challenges could be avoided potentially if we just keep in mind and constantly review the restrictions to make sure that they're appropriate and we're caring for someone in the least restrictive way possible.
yeah, absolutely. Because it's about being necessary and proportionate, isn't it, to the risk of harm and the likelihood of harm. So it's always keeping that phrase in mind as well. Is this necessary? Is this proportionate? Is this the least restrictive? Um, Absolutely. When it comes to deprivation of liberty, super important to always be keeping in mind. Yeah, Joe, I would
Yeah.
agree with that.
And I guess underlining all of what we've just said is training, isn't it? The importance of training on the Mental Capacity Act. And,
Absolutely.
so much of that was put on pause whilst organisations were waiting for LPS to come in, and understandably, because that was going to change so much. But now we have this great opportunity to reinstate, reinvigorate Mental Capacity Act training and really upskill everyone to
Yeah,
be applying it correctly.
absolutely. And I think, there's you can never have enough MCA training, is my view. But I would say that obviously
Yeah.
because anyone who'll have me come talk about it, I'll talk about it. But you can never have enough of it because the law's always changing. There's always developments in practice, in research, in the way in which we work. I've recently done a lot of work with transitions teams, children's services, following the RED judgment, the 16, 17-year-old areas. And there's always an evolving workforce, as newly qualified social workers, ASYE, social workers, same with medical professionals, learning disability nurses. We've just got such an amazing workforce that have such good intentions. And, with good training on MCA, we can really embed some good practice at the start of careers, but there's always more things we can do, hearing things in different ways from different people. I don't think you can get enough. And there was a lot of LPS training. I was doing a lot of LPS training in the lead up.
Yeah.
And I don't feel like it was wasted because it really, talked about deprivation of liberty and what we do need to do now still. And I think it's appreciating we still have to, do our very best, and we have these duties we need to comply with, and training is a good way to learn and get equipped in how best to approach that. So yeah, training is a good one.
Absolutely. Training is key. Training, training, training.
CPD.
Yeah. Oh well, I think we've put the world to rights there, Hannah. So
Yeah, yeah.
thanks again. It was really good to speak to you, and
Oh, thanks for having me.
we'll see what the next 10 years have got for us.
Yeah, we'll have to do this again in 10 years, Joe. See where we're at then. Maybe LPS will be there, or a new iteration by then, hopefully. We'll
Maybe. We'll see. Or we'll say we're still waiting for an update on when the
Yeah,
Mental
imagine.
Capacity Act code is going to be updated.
Hopefully that's not the case.
Right. Bye for now, Hannah. Thanks.
Bye.